until we get a chair and vice chair, you'll have to kind of go through the agenda till we get to that point, because none of us are in charge.
That's not in charge.
You are.
So it is 5 p.m. We will go ahead and start the meeting. Calling to order at 5:00 p.m. on the dot. Roll call. Bring the binder. I was in a hurry. So we'll go Mary Miller.
Here.
Sandra Kramer.
Here.
Pat Ripshin.
Here.
Gary Manning.
Here.
Mark Cooey.
Here.
And Elaine Henderson.
She's not here.
Not here. So we have a minute. Four. Sharing screen. Oh, there we go. So here is the subcommittee minutes from August 18th. And then approval of today's agenda verification of posting. It was posted timely. And then approval of the minutes of the August 18th Pine Valley Subcommittee meeting. Any changes?
No, but I'll approve the agenda and the verification of posting.
I'll second it.
All those in favor?
Aye.
Okay, approval of the minutes from the August 18th. Right. The motion,
I'll make the motion. Seconded.
all those in favor?
Aye.
And then public comment.
I have none.
I do not hear any in either. All right, so we are to the election of the chair and vice chair positions. This part I'm brand spanking new on.
Okay.
Just open it up for nomination.
All right,
Say it 3 times. Are there any nominations for chair?
okay, are there any nominations for chair?
I nominate Sandy Kramer.
I second that.
Are there any other nominations for chair? Are there any other nominations for the chair? So the motion for Sandy Kramer, all those in favor, say aye.
Aye.
Sandra is now your chair of the subcommittee.
And I'll take it from here.
Perfect.
And we need a vice chair position. Are there any nominations for vice chair?
Nominate Mary Miller.
You accept?
I'm gone 4 months out of the year.
Oh, come on.
I think I better pass it. I mean, I would if I was gonna be here, but I'm gonna be leaving in December.
What about
Mark?
Yes, no?
Yeah, that's fine.
Okay. So we have Mark Cooey as nominated for vice chair. Is there any other nominations for vice chair? Any other nominations for vice chair? Congratulations, Mark. You are now the vice chair of the Pine Valley Subcommittee.
Thank you. Same to you.
Thanks. Moving along to number 7, administrator.
All right, so for August, like I mentioned, we had hit our actual highest census overall. And that the highest that we got in August was 76 patients, but left only 4 beds open. We averaged essentially, let me get to that form here. Find it first. So our average was over 72 for the month of August. For right now in September, we kind of dropped in census due to, deaths, some other things that occurred. But average overall around 69 patients for the month of August. The ALF has been sitting pretty tight at 14 because we did have several of their patients, a few of them over for our rehab stay. And now they are moving back. So as of right now, as of today, they are completely full. Moving on to financials, I'm kind of keeping this one a little bit like smaller, more put together. But for August and September, if you can, July, August, and September, if you can see it, we have been averaging over $1 million in revenues. So those have been our highest months yet. There is something going on with August and Matrix, so the actual expenses are not correct. So we are going to be reviewing those, and hopefully correcting those due to some sort of geo system that is happening. So Deanna and I are going to review that on Wednesday, just to make sure we can ensure everything looks correct. Questions on the financial?
And none. Anybody else?
I have a question. I called this the other day. Was Pine Valley cited a big citation for anything lately?
Sorry, what was that?
Did Pine Valley receive any citations in past few weeks or months?
Yes, so we did finally, remember when we talked about that IJ shortly after I started? In March, we just got that fine in the mail. So that goes to county board, today. So for essentially your 3 days of our IJ having the immediacy before we removed it, was $106,000. As for the federal, the additional days from going in compliance and getting through our plan of correction, that actually was 7,700. So the total CMP being imposed on us was $114,440 for an MJ. And that was due to that change of condition that occurred back in January of 2024. So when they had gone back and did that.
Were you the nursing, were you in TOA then?
I was DON then.
Or you were?
When
When this happened?
it happened it was 25, is when the change of condition occurred. That they found when they came in March. Yes,
Has it been corrected down there totally?
yes, that's why they had to come in for a verification visit to confirm that everything had been corrected.
Okay.
Yes.
Because that's quite stymie, 114,000, that puts you work so hard to put $700,000 in that. And then you have to stay back, so you're only 600,000 now or less. That's too bad. And
It is
the county really hurts with this.
correct.
I know how deeply they hurt with this. And I did read the thing and I was quite concerned about it, hoping that everything was corrected and, did anybody get fired over that?
So essentially it was not like somebody initially or intentionally did anything.
No, is that the only way they'd be fired? No? I mean, this may be unintentional, but it was.
So it was multiple. It was multiple people. So what it boiled down to is, in the conversations that I consistently have, and this is no fault of anybody's own, is we've been doing this for 30 plus years. We've been doing this for 30 plus years. I hear that quite a bit. So when we do things, it becomes a habit, right? It just becomes a learned behavior. So it's okay to do this because nothing happened before. Maybe they weren't looking for it before, or maybe we're not catching it. We've implemented a few things, but we had LPNs acting outside of their scope of practice. We had med techs acting outside of their scope of practice, and RNs not fully being involved in assessment.
Exactly. This is where my concern was.
The biggest thing was missing that education piece, explaining to people their scope of practices.
Yeah.
Because they've been able to, do it for so long, that it just became a thing. It just became something that is okay. So is there truly anybody to blame, especially if it's been going on for several years and many of us are new into our positions and trying to rein all that in and get things back where it's supposed to be?
Because the LPN should be a bedside nurse. She should not be taking on leadership role with where the RN belongs.
Correct.
That's-
So according to state, they can pretty much gather all data. So let's say you are perfectly healthy 1 minute and now all of a sudden you're having some, I don't know, shortness of breath, because chest pain, you're automatically going out. But let's say you're having some increased shortness of breath. The LPN can do lung sounds, they can do all of your assessment, but then they need to take all that data that they gathered and they need to take it to the RN for review.
Yeah, I think sometimes they overstep their boundaries quite a bit, so.
Correct.
Isn't gonna happen now. Tell me it's not gonna.
It's not,
And-
and we're still, it's a learning curve, everybody's getting used to everybody, I've only been here 7 months.
Well, I'm not pointing at you girls, but I mean just
But to
generally.
keeping that leadership going and keeping the momentum going, people are so tired of education, they really are. And we talked about that today in a household meeting that we had on the wing, we're required to do all these things. And at the end of the day, they're just not overly excited. It's a lot. It's being consistent. It's reminding staff, because as long as we're keeping that going, then we can say we've done everything to ensure our staff are competent to their jobs.
And to piggyback off of that, I think part of it is a lot of our LPNs and our med techs have been there for so long that now the RNs are like, okay, yeah, they know what they're doing, forgetting that they need to still go in and follow up.
Yeah,
on that
well,
too. So,
yeah, sure, they know what they're doing.
sure.
I've been in that position myself, you just have to ask. It's not your role to make a decision,
Mhm.
keep them at the bedsides and keep them doing what they're supposed to be doing.
But we do have very high functioning LPNs who, like, if they went to test, they could probably get their RNs, no problem, but.
Well, they don't have it.
Correct.
They don't,
They don't.
and that's the reminder.
Yes, the liability is there and it stands with this group right here,
Correct.
and you guys. But how many LPNs do you have now?
I would say, so I think, what is it, we got Jody,
I can count real quick.
yes.
It can't be very many because they haven't been putting them out in schools for quite a while.
Southwest Tech, after your first year in the associate program, you can go and test out for your own. You can do your boards for your own.
So is that where you're getting some of them then?
A lot of the techs.
You can let me
But no,
know.
we haven't had.
But LPNs can't, they don't typically get hired in hospitals, so skills nursing facilities is where it goes, because you can hire an LPN. And like I said, there's certifications, there's things that they can piggyback onto their certificate, like draw blood, do IVs, things like that, because there's nothing in the regs that they can't.
They say they can?
They can't, saying that they can't draw
They
blood,
can draw
saying
blood.
that they can't, run an IV. But if we're providing the necessary documentation and the necessary education, they can. But we just have to make sure on our end, we do things appropriately.
Exactly, thank you.
And then I was gonna talk about the water. So I figured this would be a good opportunity to kind of, since our water's back in, we've had additional, since we went back live on our water, we've had 2 additional negative testing. We've been testing weekly.
Oh.
So just to stay on top of it, so we are good. It's been consistent with negative. So, we sent out lab testing on 9/22. And it was just our regular water requirement for the state of Wisconsin for Legionella and just making sure our well is good. We actually ended up getting our results at nighttime on the 23rd, where Chad and myself was not here, so we did not receive that until the next morning. To which that day, we immediately went to bottled water. We have to do another sample before they would put us on the bottled water notice or the boiling water notice, but we just initiated that on our end. You don't know what it is, didn't know, E. coli, if it was going to be present in another location, so we just, at that time, that specific test was only coliform positive, not E. coli, but we didn't know if it was going to be potentially positive anything else. So Chad, ended up doing new water samples, took those immediately. We were to receive our, results by noon the next day, so we just continued until we were notified that it again was positive for E. coli, or for coliform, and a couple different areas were positive for E. coli. So luckily we maintained an acted swiftly when it came to that. So we ended up going out purchasing a bunch of water. We had Culligan come out. Mark Cooey allowed us, I think, once we purchased the large 250 gallons, helped us fill them up over at Schreiber's. So we really had a lot of community help trying to get this. I reached out to several DHS, which is our Department of Health Services. Our RFOD reached out to water specialists, was in contact, and in here in this packet, you'll see like the emails, the boil water notice, just kind of the public notice, just kind of things that Jesse, myself, Mark, Roseanne, social workers, everybody did to ensure safety of our residents. I had a gentleman from who did our reservoir inspections. He came out, he's good with water. Came out on the, what was it, second? Third. He came out on the 3rd, at 10 a.m. and did a bunch of bleaching, chlorine dumping, and I think we put about, I want to say 12 gallons of bleach into our reservoir, because reservoir was one of them with the E. coli positive. And then we overflowed our pump and then ran everything through our facility. It did smell like a pool in there for a while. As of today, we have no idea what caused it. We don't know if it's, and people want to know, is it human, bovine, or what kind of E. coli it was? And we never got the testing. So with the help of DHS and people involved with that, we're calling it agricultural runoff. Because I cannot pinpoint what type of fecal matter caused arson. And we have people that don't want to necessarily be blamed for it, and there's no blame to put here. Things happened, we had a trifecta, we had construction, we had a lot of things happening all at once that unfortunately we don't get the answer of why at this time. I will say in the next week or two, we should have Watertown, the ones that did our reservoir, coming out to do the cosmetic repairs to it that are required. And then they're gonna look a little bit deeper to see if there's anything in there that could have caused it, found a way to get in, whatever the case may be. So hopefully by then we have a different answer.
I don't see any cattle on the road.
No, but we did have on the 17th or so, they laid manure out there. Okay. And then, the construction people were filling up their water trucks with the river water that was right down the road to spray on the gravel, keep it from dusting up. So there's so many ways in which we could have gotten it, we're just not sure about. And if it was an outside source, we brought it.
How close is your sewer system to your water?
Oh, no, it's across the street and it's only for dumping. So like, there's no bring back around. So like, once it goes there, it's flushed, that's where it goes.
I mean, for the whole building, that's where it goes?
Yep, across the street.
Did you ever look back, is this the first time they had a problem with it?
Yes, that I'm aware of. Again, there was a lot of records, like even when Chad came on, when we came on to our positions, there's a lot of records that weren't necessarily there. So I couldn't tell you if it happened before. But I know as of now, it has.
You ever remember? I don't.
But they've never done construction out before.
That's true.
No, I mean, I've been there, working there, and you have, I've ever remember anything.
Back then though, there wasn't as stringent. Legionellas wasn't a thing. Legionellas wasn't a huge thing. It was one of those new requirements. The water management program, I think, that wasn't even a thing until, let's see here, I want to say 2018, 2019, where you had to create a water management program. But I don't know, like, their DNR requirements, to be honest with you, anything prior to that, because it's the first time it's always been city. I've always been attached to city, still having that private well, I'm not sure. Like, what the requirements were before. And I know they're changing their requirements in 2026 too for testing DNRs. So I got an email on that, and I was going to decipher what it all meant, or try to. Might have to Google it. What other questions do you guys have?
I have none.
I don't have any more.
Nobody got sick from it, so I want to stress that as
That's-
well. No residents.
Well, we would have heard about that then.
Oh, yeah.
In general, I feel like the residents were not upset at all. The staff stayed very positive and jumped right in and helped. And I felt like it was a team effort.
I don't think you really was everything. I mean, water is,
Yeah,
you're bathing, you're cooking, you're drinking, cleaning.
Even visitors that came in with positive on.
It's good.
That's all. I would just say.
Yes. And luckily, we had some good help that helped us along the way. So I think that, it's an opportunity, for us to sit down, kind of determine how it went. Like I said, we did the after action and see what we can do better. Is there something we can do better aside from obviously our testing requirements, but is there anything during the process of the whole thing, was there anything that we felt could have been better? And I think that's gonna be, an IBT team kind of thing where we just kind of sit and see, where the struggles were and how can we make that better for if it happens again. Cross fingers it doesn't, but if, in the event of emergency like that, or the water to shut off, or whatever the case may be, what our plan is. And I think for the most part, for the initial shock of everything, I think we did pretty good.
We had a lot of help from the community too.
Yes.
That's a big, everybody always talks about, the community jumps in. And, so we're lucky to have that.
yeah, everybody did. Culligan dropped what they were doing and brought us water and
Oh, that's.
Martin Brothers,
Martin Brothers, yeah.
Mark Cooey brought us water, got us water.
We got lots of water.
Yeah. But it wasn't like, I could call at like immediately, yeah, right over. Like it wasn't a question, it wasn't like, oh, yeah, 5 days, kind of thing. So, and like Josh from the highway got the stuff over to Mark, so it was really a huge help to be able to have those people in our pockets help us.
Is there should we look at any type of, and I don't even know if there is such a thing, but is there, there's UV lights, there's filtering. Is there stuff like that we should be looking at since we've got our own well that we should protect that? You know what I mean? To
Yeah.
pre-treat it ahead of the building.
I mean, we have, I think, 5 or 6 hot water heaters that all the stuff comes into. Having something UV wouldn't be a horrible idea.
I mean, UV systems are expensive, but it's pasteurized equivalent water. Of course, we use that, so that's why I'm aware of what it is, but it's expensive, but it might be something worth looking into to see how we can protect that water.
Correct, especially with the fact that we still have no idea where it came from.
That would be the other concern.
Mark, what's UV?
Ultraviolet
Ultraviolet.
light, so there's a light, the water passes through a canister with a light, and the UV basically sterilizes the water.
Didn't somebody donate that, a system like that at Simons for their pool water?
They have that out there, yeah, we use it. Of course, we get pasteurizers too, so we can pasteurize water at the same time, but it's much quicker, it just passes through and it's it's done.
So how much are you talking? I mean,
Well, I would have to.
for a place like this?
Well, that's the thing. I don't know how many gallons they use a day, and you'd have to know all them numbers to know what that is and see if it's the right application, right? I don't even know if it is, but it's just a thought that, there's many ways to purify water, whether it's filters and ROs, and there's just several things you can do. Like we run water through a RO, or reverse osmosis, to pull all the mineral out of it. And then we UV it, and we use it for cleaning some of our processes because the membranes can't have any mineral. You don't want mineral to plug the membranes. So, I mean, but you're talking, it's in our world, right? So it's a little different than what you'd use it might not be applicable for this situation, but for us, we go through, that one system takes 6,000 gallons to wash it every time, and we wash them a couple times a day. So we're processing a lot of water just to do what we do. But
Is that a local company that put something like that in?
no, we put probably, Atlantis is the UV, and I think they're European is where that came from. But it's just something, like I said, I don't know what it would cost, but it may give you a peace of mind that, you know what I mean?
Mm-hmm.
Because it's hard to react. I mean, if you needed, I don't know, that's when they said they needed water. Well, how much water are we talking about? Because if you need tankers full of water, that's a little more logistically to try and get that figured out. But when you're dealing, it could be something to look into, that if they go through 10,000 gallons a day, whatever that is, and what a system is.
You drink that water too?
You could, yeah, there's nothing wrong with it.
So we have a comparison, Mark, do you have a breakdown what it cost you there?
I could find out we bought that 12 years ago, so we've had it for a long time, and it's extremely reliable. But I'll talk to some people and see what one would cost. It's just in case we're putting one in somewhere else, you know what I mean?
Mm-hmm.
But it's all gonna depend on how many gallons you use a day. So if we knew the gallons that are used per day,
10,000.
10,000 a day,
Yeah.
so, that's, our system easily does that. But it might cost $300,000 to put that system in.
Well-
You know what I mean? I don't know.
Yeah.
But it's something to think about.
For the assurance.
Because that was when we were talking, at first when we were talking like we were gonna have a new water source, that was my push to be on the city's water, because then you got some control there already, for the most part. Now, I didn't realize the other things that you have to test for and whatnot, but then you kind of got a reliable source. When you got your own well, you're the reliability of the well. It's no different than at home or, city water is pretty convenient when it comes to that because of the testing that they have to do and the chlorinating and they have to provide clean water.
The thing is, so there's all this other testing and they're out there and these people have to have,
Exactly.
you can't turn the water off all the time
Yeah, understood.
and leave it for these people.
Yeah, that's the fear with your own well. Because if the well breaks down, then you gotta react right now. And if you don't have multiple wells, you know what I mean, to go back and forth. There's things like that, the redundancy has to be, and that was my thought, that, you would think that the city's water is going to be more reliable than your own.
Are we still having discussions about hooking onto?
No, I don't think so, not at all, but that was my talking point with it, is because then it's more, the city's water, we go through, I would hate to guess how many gallons a day, I guess I could find out, and we don't ever run. The only time we see it's when our filters plug when they're running hydrants. So when they run hydrants, then our filters, we have to change our incoming filters, but we change them weekly anyways. That's the only time I've ever seen it, is when they're running flushing hydrants. But it's just something to think about, you know, if we could protect that water source, I think that would be,
Yeah, especially since it's just a cosmetic thing that we're fixing, and that can be done in like less than an hour. We've got exposed rebar and that, so
Yeah.
really it's a point to go to city water at this time, and things are working.
yeah, I agree, but you know, that's $1 million. I mean, if we had an extra
Yeah.
million, if we had an extra $1 million laying around, I'm sure we could find something to do with it.
Better use for it.
But $300,000 even at that, that's pretty cheap. Cause the city's gonna charge you quite a bit
Yeah,
to come out here. You're gonna have monthly charges and.
yeah, but the amount that water costs, water doesn't cost money really in the scheme of things. Where the city is it's the water use dictates the sewer bill. So that's how that works in the city residents, you know what I mean? So how much water you're taking in is how much sewer, you know, there's a calculation, because there's no way to read the sewer unless they've changed that now, but that's the way it always was before. But, you know, it's something to look into and see if it even fixes the problem, right?
Mhm.
I mean, it may not fix the problem that we're concerned about, I don't know. But there's some pretty cool filters and the way they do stuff nowadays, you know, with filtration systems and, you know, because people bottle water. Huge, huge deal. Back in '99, I went to, when we were putting new pasteurizer in, I went to Tetra Pak in Indianapolis. And the filtration systems that they were using, that's when bottled water was just starting to get going. It's crazy what they do with that. So there's plenty of, there's probably plenty of stuff out there we can figure out. Just a matter of does it work for the application we're looking for, and then the cost. And something like that where you gotta have it every day. We gotta have a backup plan of some sort, I think, to protect it. Whatever that is.
Wonder who you get was, but on a side note, federal survey came in today. They're here on 2 complaints, staffing. And then, one of them was that, do you guys know those things that you put on the wall and it sprays every so often?
Yeah.
And it gets a pretty scent. Well, they claimed, the staff member or whoever called it in, claimed that gave it 4 of our residents pneumonia. So they're pretty much sending our surveyors on a wild goose chase. Okay. Like wasting our time in the.
Do you have these just like in the restrooms, or where do you?
They're in the hallways here and there, but I think there's 3 throughout the entire building.
Oh, my. Okay, so that's why state is here now?
Federal.
Oh, federal, so.
Feds.
ooh,
Our feds
feds.
are there.
Feds.
So what'd they do?
Nothing, well, he'll be here tomorrow, that's why I don't have anything to actually fully report to you guys, just letting you know they're in the building, so I'll have a full report for you next month's meeting. But essentially, when I was talking to him, he said he laughed a little bit about the aerosol. He said when it came across his thing, he said he had a laugh, so he is going to meet with our medical director tomorrow, to ask that question, can the aerosol spray, or whatever question he plans to ask, but essentially it's about that, can it cause pneumonia? We already did our investigations regarding staffing, they were fine. Yeah, and then we looked into the pneumonia cases that were claimed to be, and they were aspirated pneumonia, which is inhaling fluid.
Mhm.
One was
And one was named pneumonia with COPD exasperation. And that particular resident wasn't even close to,
Who is the medical director right now?
Dr. Sidhu.
Dr. Sadhu
Sidhu?
is out of both medical.
Yeah, old medical.
As you guys run
Felt like it. Well, actually, we actually did have a state surveyor there too this morning.
And
And that was just for, so we tattle on ourselves and say, hey, we caught this is, like, let's say, for instance, this particular one came out because we self-reported on something not intentionally not following the camp care plan, but because they didn't and the resident did fall. We self-reported and she was just, they're required to look into so many cases and the caregivers involved. So that's all she was out there doing, and she was had talked to a couple of our staff members, and they said, we do up our building specifically to the staff member, and we'll get a letter. There was something for the building, and it's just whether or not they were taking actions to get CNA. Yeah, she was gone by 10:30. She showed up around like after 8:30, and was gone by like 10:30.
anything else? Little black rain cloud going away yet, or
I'm
what?
gonna sage myself.
Okay.
There was bad juju. No, anybody with a giant stage that's flying phone on the building too.
Hmm.
It's just unfortunate.
It is. It just seems to be happening all at the same time.
Any other questions you guys have?
I-
Comments, concerns?
I have no.
No other questions, and I have nothing else to report at this time. Otherwise, are you guys ready to call this meeting?
Well, I will ask for a motion to adjourn.
Motion to adjourn.
All in favor, say aye.
All right.
All opposed, you may stay. Thanks, guys.
Thank you.
We should return.
Yeah.
Hi, Judy.
Okay.
Ooh. That might- 26.